Hey guys!
Hi!
Let's just wait for some people to join us. I know, are you going to be able to read the comments?
I don't know, we're gonna have to give it a try. Especially after a couple of these, we might not be able to.
Exactly. Alright, so tonight, as planned, we are talking about penis filler. It is our wine and wiener night, guys.
Cheers, Justin!
Cheers! So if you don't already know us, I'm Justin.
And I'm Jenna.
And we both work for Dr. Jason Emer. And we're discussing everyone's favorite topic, which of course is penises. So guys, this is a Q&A, so please, if you have any questions about what penile enhancements that we can do, please let us know so we can answer those. I see people are already writing hello. Hello, oh, hi guys. How are you? So what would you guys like to know? Let's see, what can we tell them about penises?
Well, we can get started kind of on the process and consultation, coming in, meeting with me and Dr. Emer, and just how it goes. Everything is, super confidential. We want you to come in and have a comfortable experience. You are going to be meeting with me and Dr. Emer at the time. We have, special techniques that we do, and we just want to make sure your experience is comfortable at the end of the day.
And it's super easy, guys. So a lot of questions that we get asked is, how does that process work? Can I come in? Can I do the consultation and do treatment the same day? Which you can. It's super easy. We numb you right in the office. You can do the treatment. You're in and out. Let's see. I haven't been watching the chat. Is there any questions? Doesn't look like it. Well, guys, what else can we say? So one question that we get asked a lot is, what exactly does it enhance? Is it mostly girth? Is it length? What are we talking about? So with filler, it's going to help with the girth. However, when you are flaccid, it will help with length. But with erections, you're going to be the same size. So it's going to make you more of a shower and not a grower. Hopefully you guys are familiar with that phrase. If not, Google it, because we're not going to explain it here. But a lot of men like it because when you are flaccid, some guys want to, look like that they have a little bit more going on down there.
Any questions yet?
I haven't seen any questions, but honestly, the text is really tiny. Now, another thing that we can do is also, when the girth is increased, we can also increase the size of the head. And this is where Dr. Emer will actually inject the corona of the penis, which means crown in Spanish. So it's that little crown around the head, and we can enlarge that to kind of make the penis a little bit more even. Does that make sense?
Yeah.
Yeah,
So,
absolutely.
I think we should talk downtime because that's another really big question.
Downtime.
After the procedure, there's always some bruising, some swelling, which is minimal. Most patients tell me from experience is that it doesn't even hurt that bad. And then also when it goes to downtime, I would say about 5 to 7 days of no masturbation, no sexual activity. So it's not too much.
A small price to pay for a bigger number. That's all I'm saying. So typically the downtime's super easy. I've never had any patients complain about the downtime. You do swell a little bit from the filler, which I've never had anyone complain about that. I typically get the complaints when the swelling goes down. And the best part is about the HA filler is that it's not permanent. So it's a good way to test the waters and really see if you like the results of the penis filler. And if you do, there are some more semi-permanent and also permanent options that you can do. So one of those semi-permanent options is using Bellafill. So Bellafill is a PMMA filler that can last upwards of 8 to 10 years, sometimes even longer depending on the person. So we mix it with the HA, we put it in the penis, and you have a much longer lasting result. And we do have a lot of patients that do that. But then we also have a lot of patients that do fat grafting.
Yes. Fat grafting, what it entails is we have to harvest fat from some area, so it could be that spare tire you have around the waist, the flanks, kind of any area of concern, so you get the best of both worlds. So
and we all have that COVID-15. We can put that fat to use.
Yeah, so the best of both worlds, you'll be able to enhance the girth of your penis as well as flatten that tummy area, the pubis area, flanks. There's plenty of places we can get it from.
And it's great. And we always recommend doing fat storage with a fat grafting for the penis. The reason being is guys always want more. So instead of having to go through a second surgery, we just get that fat that we stored and we re-inject it about 3 months later.
Yeah, and when it comes to the amount of treatments, it really depends on the patient and how many fillers we also need to use. We have...
Ooh, there's been lots of comments, guys. Oh no!
We're the worst.
Let's see. Who besides Dr. Emer works on patients' laser treatments? All right, so we're getting a little bit off topic, but that is okay. We'll answer your question. So we have a PA, we have an RN. They're all trained by Dr. Emer. So we actually have a lot of providers in our office that can do laser treatments, that can do filler, that can do neurotoxins. But Dr. Emer is the only one that is doing the penis filler. That does require his expertise. Now, oh my gosh, let's see what other questions we've missed. Okay, does fat transfer affect erections since it weighs more? And can you do filler and fat transfer at the same time if you don't have enough fat?
Absolutely. So it will not affect your erection in any way. And kind of off topic of filler and fat transfer, there is something that we can do called the P-shot. So what it's gonna do is actually enhance your erections and overall sexual health. But yes, you can do filler and you can do fat grafting at the same time. There's no problems with that. Or you can do fat grafting, and then you can also add filler, or you can do fat grafting and then, or filler and then add fat at another time. So you're not
how many glasses have you had, girl?
Whoa, worry about a few. So you're not just stuck to one thing.
So you can layer the treatments. That's what we're saying. All right. Hopefully we haven't missed any more questions. Sorry, the chat wasn't moving, guys. Little technical difficulty with the wine. With fat transfer affect erections? Okay, we already answered that one. Sorry, I had to repeat your question. I want to make my man's thing much bigger and wider. Well, girl, you came to the right place. You can do that. Have him DM us his full name, his phone number, his email. We'll get back to him, and then we will give him a bigger member. Okay. Let's see. How many syringes do you need? Oh my God, this is such a loaded question, Lindsay. So it really depends on the size of your penis. So say if you're on, the smaller side, you actually need less filler to get a better result. However, if you're on the larger side, you actually need more filler to get a bigger girth increase. So a lot of people think it's the opposite. If you're bigger, you need less. But actually, if you're bigger, you need more. Now, I would say if you're on the bigger side, you can go anywhere from maybe 8 to 10. But you know what? Not every penis is made the same and every man is different. So that question really does require the consultation with Dr. Emer, but he will specify how many fillers he thinks that you need. Okay, let's see. I know, there's been a lot of questions, guys. Thank you for that. Ooh, a lot. Ooh, do you guys have details like if we come in together and both get some work done at the same time? Absolutely. We have couples come in and one couple does another thing. It's great. We also have mother and daughters come in. It's fantastic. I think you should come in with a family member. They can be your moral support, through the whole process. All right, let's see if I can get this chat actually moving so we don't have to keep getting up. All right, what can I do to help my erections and sensitivity?
That will be the P-shot.
Exactly. Can I get it done the same time I get my Gladiator 360?
Absolutely.
Yes, you can.
We love the combination treatments. Like I said, you can do the fat grafting to the penis that day, or you can also do fillers. We have a lot of patients who decide not to do the fat grafting. They want to go the filler route. We can absolutely do that during surgery.
And it's honestly recommended that you do it because you're doing one surgery and you're killing two birds with one stone. But remember, during that surgery, do the fat storage because then you can come back 3 months later and get even a bigger dick. And come on, who wouldn't want one? All right, I think we answered all the question, guys. If you had a question and we didn't answer it, please hold on. There's I think we might have someone.
It's pretty even. I mean,
Oh my
hey!
Surprise!
What are you doing? Oh, are you out and about? No, you're on your balcony.
I was just paying attention, and I heard how you guys were getting a huge audience, so I had to join in. I figured you guys were already having a blast tonight with your wieners and your wine.
Oh, absolutely. Let's see.
How are the questions going?
Speaking of wieners,
Here's a wiener right here. Here's a wiener right here.
Aww. Hey, Lexi.
There's a hairy wiener.
Ask us about your wieners.
We're here to answer your questions.
So yeah, you
Everyone
guys.
was talking about... Come on. Let's see. I think there were some questions.
I wanted to know, one of the things that people always ask about is sensitivity. Does the fillers affect sensitivity? Did you guys answer that yet?
We haven't, but you know what? We do get that question a lot. And guess what, guys? It doesn't. You're still going to feel everything. Your partner's going to feel everything. And your partner's going to be more satisfied because guess what, guys? It's really not about length. It is about girth when it comes to satisfaction. And I think all you girls and gay guys out there would agree.
Cheers.
Cheers.
We can do the pea shot. Boys and girls both agree. We can do the pea shot. We can do stem cell therapy too. Tell them about that.
Ooh. So guys, what Dr. Emer is talking about is the pea shot. What it does is we use your own PRP, which is platelet-rich plasma. So we do draw your blood, we add some stem cells to it, and we inject it directly in your penis. And you can actually do this at the same time as penis filler. And what it does is it actually does affect your sensitivity. What it's going to do, it's going to help make your erections harder. Who doesn't want that? Some other things are going to be increased as well. And it's something that you can do every 3 months. And guess what? You will be on your sexual A game if you do.
Do we have payment?
Lindsay wants to come on, she said.
Okay, tell her to come in. How
Yeah.
do you do?
So you guys, I'm really excited that we're doing this.
So yes,
I'm really excited we're
do
doing
have
this.
payment, guys.
I'm excited we're doing this because so many women for so many years have gotten all these treatments. It's no big deal. They can go get their boobs done. They can get tummy tucks, get their vagina reconstructed. But the men never did anything before. And now the men are also doing
it's like a conversation a lot of men don't want to talk about. But at our office, we're very open about it, and we're here to help. And we love the transformation. And all of our patients that do penis filler are extremely happy, and they always come back for more.
I know, it's like a lip. They always want more when the swelling goes down. And I want to be able to do it, which I love to do. And our patients are always so happy with it. It's so surprising. You guys watch our YouTubes. They almost have no pain. It's done really, really with a really special technique. And we can keep building. We do it slow over time.
Lindsay, send the request again. I see it.
She said, Justin, accept her.
I know, I'm trying.
We have tons of before and afters, you guys, online. Which wine are you having? They want to know.
Which one are we having of what?
Wine?
What wine?
Oh, well, this is a red blend. I love my red blends.
This is a Sauvignon Blanc, where I like to call it the SB.
Let's see. Is it performed with an erection or flaccid?
Exactly. It's your favorite.
Flaccid during the procedure. We don't want you erect, and I think it'd be hard to maintain an erection during this process.
We can do it. In the old days, I used to do an injection that would make people erect, and we'd do the treatment, but then the results actually were more lumpy. So we do it limp. It's better to do it that way. Listen, try and get Lindsay. She's trying to get on there. Let's see if it works.
I don't see her request. Lindsay, where are you? Send another one.
Hey, Larry. Larry's saying hi to you guys. Downtown Larry.
Hi, Larry. We miss you.
So remember, you guys, too, even though we're talking about men, the women can get their lips plumped, too. We do that frequently, right, Jenna?
Wait, are we talking about these lips or those lips?
Yes.
Those lips.
Both.
Don't forget ladies
Both sets of lips, guys. Both sets of lips.
Yeah. And you can tell your family and your friends you got your lips done and they won't know which ones.
Exactly. And no, we do not inject the urethra, you guys. That's a danger area. All right, well, I'll let you guys go. Let Lindsay come on. I'll get off. Maybe that's why it's not working. But you guys, we really do this in the office. We have an entire website dedicated to this. Check it out. Type in Jason Emer, penis filler, and it will come up. And then you have your resident experts there, Jenna and Justin. They can handle anything you want to know about wine or wieners. They are there.
We are the penis experts.
They can do it all. So, all right, let's see if I can you guys get Lindsay on. Have a good time.
Okay.
We will.
Bye.
Bye, Dr. Emer.
Bye.
All right, let's see. I'm definitely not. All right, Lindsay, send it again and we'll find you. Hopefully.
Is that maybe like the little people right there? Oh, there we go. There we go.
I think we did. I think we figured it out. All right.
Oh, no.
Can't wait. I'm so freaking excited. I hope you are excited. You should be.
I was getting a little low.
Hey,
Lindsay.
somebody's wieners and wine. I came running.
Absolutely. I think it is a thing to
Two of our
celebrate.
favorite things.
So
These
guys,
are my
if you don't know Lindsay, she is another coordinator who also has some expertise with the penis filler.
I sure do have some expertise in that area. I also that's not the right word. I specialize in buttock enhancements. So if you want a non-surgical BBL or if you want your hip dips fixed, I'm your girl for that one. Yeah. So and Justin for
major one.
Yeah, and I've personally done it myself and I highly recommend it.
Take it. I take the backside.
Cheers, Lindsay. All right, guys. So what other questions do you have about penis filler? Every time I go to dinner with my friends, they can never stop talking about it, and I have to talk about it all night long. So I know those questions are still there.
I did see a question come up earlier that was asking about Botox to the balls. Do you guys want to answer that one?
Scrotox. Okay, let's talk about some Scrotox. So if you want some low hangers and you need the extra help, you can absolutely do Botox in that area. Why are you guys laughing at me?
I think Justin might have had enough.
Oh, I'm not even like halfway through my wine, guys. We have a long night to go ahead of us.
I might have had a little bit more than you have.
So, but as you know, neurotoxins work for about 3 to 4 months, depending on the quantity, the amount that you do in the area. So if you're like an avid runner or a bicyclist and you're always kind of chafing or you're just sweating in areas you don't want to be sweaty, this is a really good way to kind of help solve that problem. Does your man go down on you? That is quite the personal question there.
I don't think we've had enough wine.
We haven't had enough wine to ask us once we finish the bottle. You know,
I don't know.
Probably.
We're talking about enhancing your down under regions, not about our sexual activities. So.
But I mean, if you enhance your down under treatment, then you might get some more action. I mean, who knows?
There was some
happen.
There were some questions earlier that I saw too. There was a lot of people asking about cost and quantity. You know, I know Justin touched on this earlier, but it is a range. It's a range between exactly what you need, what your starting point is, what your end goal is. So starting, you know, the very minimum, doing something like 8, but I mean, we've had people starting at 16 syringes, 18, just depending on your financial situation and what's going to give you the best result.
Yeah, come in for a consultation. Honestly, that's the best bet. And then, you know, I will be doing the consultation with Dr. Emer, and then take it from there, be your person all the way through. And we can talk about financials and all that good stuff. And then even if you wanted to do same-day treatment, we are okay with that and ready to go.
Absolutely.
Yeah, we do that.
This is
There's
one of
also
our more common procedures, actually.
We probably do like at least 4 or 5 a day, I'd have to say.
Yeah, we do. It's become increasingly popular, and kind of like what Dr. Emer said before he left, is we do have, if you go to our website and go to our penis enhancement page, there's actually a lot of before and afters that you can see. So a lot of guys are always wondering, well, what is it going to look like? You know, I want to make sure that it doesn't look like it's been altered. I want to make it look natural. Well, guys, it does. So I will let you know that penis filler, it is kind of a 2-step process. So during the first appointment, oh, sorry, I'm just taking up a lot of space.
I'll just
couple questions that just came through that I want to get before they answer. Somebody asked if your consultation fee goes towards your treatment. Yes, it does. Your consult fee goes towards your treatment. And there's another question that just came through on circumcision. So do you have to be circumcised to have filler in your penis, or can you do it uncircumcised?
So if you have a little hood on your friend, that is totally fine. We can still do the treatment. So it doesn't, you can laugh, Lindsay, come on. So you can do this treatment if you're uncircumcised or circumcised. So there are 2 types of techniques that Dr. Emer uses, and that's why everyone's a candidate.
And that's why you need to come in for a consultation, honestly, best bet, because every case is different.
Yeah, and you can also do a virtual in case you don't want to come in. Don't forget about those options. So for those patients,
yes, virtuals are great. All we need are some photos.
Oh, I love all the love.
Yeah.
country across the world, you can just send for us. We'll review. And this is something that we do every day. This is very normal. So even if you're anxious or nervous about sending in photos of your, you know, your down unders, your penis, and whatever you have, even when we're talking about like bleaching those areas, this is something that we deal with every day. We're comfortable with it. And it's not anything that we're going to judge you on, depending on where your beginning endpoint is, whether, you know, no matter what size it is. This is something that we see every day. So we're fine with it, and we're comfortable, and we want to make you feel comfortable also. So we'll talk to you and treat you with the utmost respect the entire time.
The safe.
Yeah.
They're a safe place. We do it every day, you know, and we're honestly here for you. We want to make you happy. You know, if you want a bigger member, we can actually deliver that for you.
Yeah. I mean, like we're having fun right now because we're having a little bit of wine. We're trying to take the stressful situation for some people. So we just want to know that we are a fun environment, but we're also that professional, respectful side too. So we will be here for you in any kind of
open conversation that we're here to have, and we treat all of our patients with the utmost respect, no matter who you are, what you're in for. Definitely make that disclaimer.
For sure.
But yeah, I would have to say this treatment has become increasingly popular probably over the past year. You know, there's not a lot of physicians that do it, and there's definitely not a lot of physicians that do it well. And, you know, Dr. Emer's been doing it for a while. He's perfected his technique. You know, he's really good, you know, at listening to the patient and really figuring out, you know, the concerns and addressing those concerns. You know, and that's the whole reason why we're here. We just want to make you happy. We want you to have, you know, if you want a bigger penis, we can definitely deliver that. Yeah,
and then even after your procedure, we want you to know you are very well taken care of. We're constant contact with our patients. We want you to feel, we understand the sensitivity of what you're doing. So we will be here for you every step of the way. That's really big in our practice. The concierge experience, you know, you're part of our Emerage family once you come in, and we can't wait to see all of our patients and coming in for whatever, from penis to face to body, whatever it may
To
be.
both sets of lips, depending on what your concerns are.
All of it, lips and tips.
I saw a question about a P shot. How do you get it done? Obviously, book a consultation. We can talk to you about what the benefits of the P shot are, what it really enhances, and how many times that you need to do it. So one thing that I do want to talk about is, especially with these non-invasive treatments, it is something that you do kind of have to make a commitment for. It's kind of like going to the gym. I always use this analogy, but it works so well. Lindsay's trying not to laugh because she knows exactly where I'm going with
it.
this.
Does. I use it too.
Exactly. Like with the P shot, guys, what it does is it really does help it's like the health of your penis almost. But it is something that you kind of have to do regularly. It's not like a one and done thing. It's kind of like working out. If you want those biceps, girl, you better start lifting and get yourself on a schedule. Well, it's the lips and tips. I love that. Sorry. Totally got distracted. But it is something where, you know, with the P shot, most men, I would say, come in every 3 months to do it. And it actually does help with erectile dysfunction. So if your man's having a hard time getting up, or if you're just nervous about, oh my God, if I get older, if I'm going to have ED, start the P shots now. It's so much easier to maintain than to reverse. This guy loves penises.
That's great.
Oh my God, obvious?
Yeah. I know they do. They love penises. So while we're on the subject of penis and not only enhancements, there's a lot of other things that we can talk about too. There's a treatment called Evive. So that's a great option to add on to any kind of treatment that you're already doing for enhancement of your penis, to add sensitivity, add blood flow, circulation. So if you guys want to dive in any more on Evive, that's something. That's something we have. Our guys love Evive. They love
a lot of people know about like Cellutone. Cellutone is another form of Evive. Evive is a little bit newer device, so I think it does tend to work a little bit better. But what it does, it really helps kind of increase the blood flow to the penis. I have patients, and I think Jenna, you have patients too, that come in once a week for this treatment. Mm-hmm. You don't even have to numb for it. It's super easy. It's in and out. There's no downtime to Evive. And it's something that you can do at the same time as penis filler. So all these treatments, the P shot, penis filler, Evive, you can do this all in one sitting, guys.
Yes. And for those of you who are confused about the P shot, that's going to be PRP, your platelet-rich plasma, and Acell, which is a stem cell. And it's an injection that Dr. Emer would inject into your penis, and that's what is going to enhance sensitivity. And that can be done every couple months. You can keep up with it consistently to, you know, have the best sexual experiences that you can.
And then also women too.
It's called the O shot, guys.
Anything we can do for the girls too. We're going to have a part 2 where we're talking about lips and lips or something, because if we can do we can do an O shot. We can also, people, you know, not to go too off subject right now, but we can also, you know, plump up or fill up the vagina, make it a little puffier, or like fill it out, whatever you're needing for that. That's a whole new story for a whole nother week, but stay tuned, Jenna. That's going to be a part 2 series.
Part 2. Oh, there we go.
So pretty much what we're saying is, if you want something improved, we can probably do it.
Yeah.
So if you
From
do
head to toe.
and to both sets of lips and everything in the middle. Oh, what's the O shot? So it's just like the P shot. It's where we take PRP, which is your platelet-rich plasma. We add some stem cells to it, and we inject it into the clitoris, and we inject it into the wall of the vagina. So what it's going to do, it's going to make women, it's going to make you much more sensitive. If you've been having problems with getting an orgasm or anything like that, or wetness, this is going to help you out. Absolutely. Oh. So there are solutions for you. Ooh,
I suggest, while we're talking about our male enhancements, so whether you are, you know, if your partner is male or female, we also have tightening options for your partner. So while we're talking about your enhancements and getting your penis a larger size, we also need to discuss the part of tightening up where you're putting it. So we have tightening with the Juliet, and that's also going to resurface the inside of the vagina. We also have like anal tightening, so we can do a bunch of different options on that. So although you're thinking, oh my gosh, I don't know if I want to go that much bigger because, you know, my partner is doing really great. That's fine. Don't worry about it. We can tighten up any area, any hole. We got something for it.
We got everything for it.
Half a glass of wine and I'm just spitting out facts over here.
You
like,
got it, girl.
Yeah.
Guys, we live
Kind of
it.
the inside
We
or the
love
outside. All.
it. Yeah, exactly. So men,
Here we
women,
go.
we have enhancements for everybody. So if it is something where, you know, you are nervous about, you're not getting enough, you know, sexual enhancements, we got you. Got some laughs. We got some laughs.
Here we are.
And here we are at 8:30
All right.
Pacific Standard Time.
Yes, I'm going to off and let you two finish up and wrap up whatever you have. It's been fun. Thanks so much for letting me crash your live after Dr. Emer came on. It's been a great time. I need to read mine, so it's time for me to exit.
Yeah. Thank you so much, Lindsay. See you tomorrow.
Thank you for your
Bright and early.
expertise. All right. So I think one of the questions that I saw is the tightening permanent? So this kind of goes back to my whole workout analogy. So the tightening is not going to be permanent. So it is something that you do have to maintain. Now, everyone is a little bit different. Not everyone is made the same. So some people are going to have to do it every 3 months. Some people can do it every 6 months. And maybe some people will do it once a year. It really depends on what your expectations are. And it depends on how tight you want to get or how loose you are now. I mean, there's a bunch of factors. And really the only way that you can really figure out what the right thing is for you is to get a consultation with Dr. Emer. So everyone always wants to know specifics, you know, without they seeing the doctor. And that's really difficult because everyone is so different. Our body chemistry is different. You know, the way that we react to treatments are differently, you know, so that's really where you just need to meet with the doctor. Let's see. Your wife is beautiful. Oh my God, they think we're married. This is my bestie. Oh, okay. So I am a 25-year-old Iranian young man who blocked my page.
Oh, no, let's not go into that one.
Yeah, that was not an actual question.
No, let's not reading that one.
Oh, and there's the dog.
She's not a wiener, but she'll do.
She's so cute. Let's see. I think there have been some other questions. I think one of the main questions that we also get is what do we do to help with payment options? So we use third-party lending companies, guys, and there's traditional loans that you can get, and you can also get something called Care Credit. I know a lot of people are familiar with Care Credit. It's like a medical credit card, and I think right now they're actually running a special of where you get 6 months, no interest and paid in full. So that's something you can take advantage of, and you can also use it at the dentist. You can use it at other medical establishments.
And this is something that will help you with it when you come in the office. That's actually our job, is to, you know, ask any question that you could possibly ask. Nothing's off the table for us. We've heard it all, but we want to help you in any way possible.
Absolutely. Let's see. What is this? We're talking about penis filler and male enhancement.
Late
so,
to the party.
Exactly. Like Dr. Emer said, if women can enhance it, men should be able to enhance it too. Let's see. Oh my God, what a pair. We get that a lot, especially when we're drinking wine.
Yeah, we're a problem.
So kind of like what we've talked about, if you have a lot of concerns, you know, come in with your partner. We can discuss everything. Oh, there was another question.
What happens anatomically with the
Ooh, when you do the tightening. So what it does is actually so the lasers rejuvenate the area. So whenever you use energy, which for this, it's radio frequency energy, it's going to help tighten. So it's going to increase collagen production.
I missed that one.
What? There was another question?
It was about stem cells.
Ooh, I love stem cells.
Storage.
Let's see. Also this month, Forever Lab Stem Cell Storage is having a special. Oh my God. So Forever Labs. If you guys don't know about Forever Labs, it is a company that we can actually take the stem cells from the fat that we get. So say you're doing like gladiator lipo, or you're getting some fat for your down under member.
Or your buttocks, your hips, chest, whatever it may be.
So what this company does is they take the fat, they get the stem cells from the fat, and they culture the stem cells, and then they can store it. So whatever age you are, like I'm 30. Oh God, I'm 30.
I'm 36, so I got what you beat there.
Well, anyways, I mean 30s aren't great. But so if I got my fat taken now, it would be my 30-year-old stem cells that this company would store. So in 20 years, when I'm 50 years old, God help me, I can use these 30-year-old stem cells to I can help with joints. I can inject it in my penis. So if I have erectile dysfunction, I got that under control. So that's what Forever Labs does. It is all about stem cells. Stem cells are the way of the future, and it's only going to benefit you.
Yes. So how do patients make appointments?
Oh my gosh, that's so easy, guys.
Potential patients.
You can DM Dr. Emer on his Instagram. You can go to our website, fill out a form. We'll get right to you. You can email appointments at jasonemermd.com. Guys, there's so many ways to get appointments and to get in contact with our staff. We have a great concierge service that can set you up with your appointment. So in terms of consultations, you have several options. So our first option is you can do a paid consultation with Dr. Emer. You can also do a virtual consultation with Dr. Emer. So if you're in Europe, if you're in the UAE, if you're in New York, Miami, Seattle, I don't care where you are, you can do a virtual consultation. We can plan your treatment before you come to the office.
Yeah, and then please reference our website, jasonemermd.com. We have a lot of before and afters. It gives you a list of every single thing that we do in our office. There's probably even more beyond that. We literally do everything from A to Z. We treat males, females, any type of ways of life. Everyone is welcomed. We do love our patients. We love what we do. I go into work every day with a smile on my face and leave with a smile on my face. I really, really love the life-changing experiences that we have at our office. Honestly, that's what we do it every single day.
Exactly.
Yeah.
And we have spent a lot of time on our website, guys. It's all information for you. You know, we do get a lot of calls about people just, kind of shopping around, not knowing what they want to do. Guys, go to our website. It can really help you steer you in the right direction. And if you need further help, feel free to call the office. We have staff on the phone Monday through Friday. We have staff working on the weekend, and they can answer any questions that you have. So they are highly trained. I trained them myself, so I can say that. But guys, we're really here for you. So there's a lot of misconceptions, about this industry. I feel like a lot of people don't even realize how much we can actually do for you. So you can always call in, ask those questions, and we can get you those answers. So I know tonight's just about, wine and wieners, but there is a broad range of treatments that we do. Dr. Emer is great at, the gladiator procedure, which is high-def liposuction. It's not regular liposuction. There's about 5 steps that he does during surgery, to get you, those good results that you see on our Instagram.
Yeah. We have skin laxity treatments. We have acne scarring, active acne treatments. Honestly, we literally do every single thing you can possibly think about our office. We touch every single base, and we're here for you, and we would love to see you in our office. I'd love to meet all these wonderful people in person. So reach out to us on any avenue, and we're here for you. We'll also be in New York soon, so we're going to take care of our East Coast patients. We'll be there November 12th through the 16th. We'd love to see you guys there, and I'd love to meet you guys all in person.
Absolutely. And if you don't know this already, you can actually come into our office and meet with a coordinator for free. So a lot of people think, oh my God, why would I do a free consultation with a coordinator? What do they know? Well, I'll let you know that Dr. Emer has trained all of us personally. We know a lot, but also at the end of the day, Dr. Emer does give us recommendations on the patients that he does not see. We use photos, we communicate with him. So essentially, even though you're getting a free consultation, you're still getting information from Dr. Emer. So if you're like, ooh, I don't want to invest in that consultation fee, I don't know if that's right for me, I don't know if I want to make that investment right now, come to the office and meet with one of us for free. We can talk about your concerns. You can tell us, what you want to address, what you want to improve. We'll meet with Dr. Emer at the end of the day, and then we will relay you the information that Dr. Emer gives us. You know, so there really is no excuse to get that information that you guys want.
Yeah. I'd love to see you in our office, and this has been really fun and informative, and come in and ask any question that you might have, and we're here for you, and any avenue that might be, if it comes to the face, if it comes to down under, full body, we're here.
And if it comes to a random skin tag, we also do that as well. Really, nothing is off the table here, guys. So, but like I said, you know, if you have those questions, feel free to call. We'll get you those answers, and then meet with one of us, meet with Dr. Emer. Obviously, he is the expert. He does know a lot. And, you know, if, you know, check out our Instagram. We are so transparent about what we can do. We really don't hide anything. And guys, honestly, like, our practice is a family. So we all get along. We're all best friends. And like, if you like our energy tonight, this is what you're going to get in the office. Okay. Okay. How much is the consult for fillers? Okay. So a consult with Dr. Emer is $500. Again,
go towards your procedure or whatever treatment you decide to do.
Boom. So, and then if you want to meet with like a mid-level provider, so like a physician associate or an RN, that is $150. And again, that $150 can be used towards your treatment. So you can get those answers, and then if you don't want to pay anything, you can meet with a coordinator for free.
Yeah.
All right, God, I hope we haven't missed any questions, guys. If we missed any questions, please post them now. We'll get to them. The comments are moving super fast, and it's really tiny.
They weren't like going at all, and now they're like super fast, and I've had a couple of these.
Oh my God, I've almost finished my. I hope everyone else is drinking wine with us. We can just have a night. Let's see. A lot of people are joining, which I love. I love to increase the education of what we can do, because I think a lot of people don't even realize the treatments that we can offer and the things that we can improve. Oh, and there's a lot of hearts. That makes me happy.
Yay.
Is there anything else that we'd like to discuss?
No, I mean,
I know we talked a little bit about what your options are. So again, I will just kind of do a little summary of what we've been talking about. So in terms of penis enhancement, you can do HA fillers if you want to kind of test the waters and see if you like the enhancement. Fillers tend to last about 10 to 12 months in the average person. If you have a very fast metabolism like this one does, the HA fillers aren't going to last as long in you. If you work out a lot, you know, if you run, you know, the fillers aren't going to last. However, if you want more of a permanent option, you can do something with fat grafting, with the fat that is permanent. A little bit of the fat does go away, but about 70% of the fat stays because we purify the fat before we inject it. Was there a question that we didn't answer that?
There's a lot going on in there.
Okay, hold on. Let me... Oh, that really makes me pasty. Should we avoid wearing makeup if we're coming in for a facial consult? Yes, we want to see how your skin looks. If you're wearing makeup, we could miss something, like if you have facial redness or if you have pigmentation. It's really important that you come in. So we're so used to people coming in with a clean face. Don't worry about putting on your makeup, putting on your face. We really want to see you for you. The whole point of improving your skin is so you can wear less makeup and you can look like yourself and you just have bright skin. All right. Oh, we just had several questions come in. All right. I'm going back, guys. I'm scrolling back.
You look like you're on like Twilight.
I know. But guys, if you want glowing skin like this, even though it's a little bit washed out, just do some laser treatments. And we have about 60. Oh, Craig, love you. So, I mean, okay, can you please say happy birthday to my BFF? His name is Nick.
Happy
Nick,
birthday!
happy birthday! Oh, I love birthdays. Wait, Jason, you look different. Oh my God, I'm not Jason. I'm not a doctor. I work for Dr. Jason Emer, though I am confused with him a lot, apparently, which I will take that as a compliment.
You look like you had surgery, like when it's like...
Oh, I know. Maybe I need some buccal fat.
Look!
Let's see. I don't think we missed any other
I don't think we
questions.
missed
Oh,
much.
guys, this text is so small. Okay, I think... Oh, wait. Are fillers safer than fat grafting to the penis? Ooh, so in terms of safety, we have a lot of precautions that we take. Now, I can let you know, I think we do like 3 to 4 of these a day. We very rarely have complications. And the complications that we do have is typically that some men are a little bit uneven after the first round of fillers, which I just realized we never really talked about this.
The building process.
The building process. Yes. So when you get penis filler, I always say it is at a minimum a 2-step process. So when Dr. Emer first injects the filler or injects the fat, his main objective and his priority is increasing your girth, men, like that. So because of that and because of the way the penis is, sometimes it can be a little bit uneven, which is why we typically schedule an appointment 2 to 3 weeks afterwards so Dr. Emer can go in with a little bit more filler and even everything out. So trust me, I have a penis. I get it. It can be absolutely terrifying, but if things are uneven, it's actually a very easy fix. So not everything is going to be perfect. So that's why I always say be prepared to come in twice, especially if you're not circumcised. It adds a little bit of a factor because there is extra skin, but again, we can even that out for you. All right. Kiss to baby. Wait, which one is he calling baby? I think that'd be directed to you.
I don't know. Who knows?
Maybe.
Depends. We got every little bit of things here.
Absolutely. So I think we answered all your questions.
Yeah. And if you have any more questions, you know how to reach us.
Absolutely. Hi, how are you?
We're great.
Oh, we're amazing. It's Thursday night. We're having some wine. Do what? Well, in terms of.
There's a lot.
How is Bellafill? Okay. So Bellafill is more of a semi-permanent injectable. It is not HA filler. It's not made of hyaluronic acid. It's made of PMMA microspheres. So what that does is it creates a scaffolding underneath the skin, and it actually lasts a very long time. So it can last. Are you gay? Oh, honey, if you can't figure that out from the way I talk, come on. So the answer is yes. So the Bellafill, it's going to last about 8 to 10 years. So this is something to where we'll inject it with hyaluronic acid. And again, it is a building process.
Yes, we don't traditionally start with the Bellafill route. We want to make sure it's something that you love, which most patients do. But first step would be the HA, the hyaluronic acid route. And then we would switch to the hyaluronic acid base filler plus the Bellafill.
And when you do come in for your consult, we can discuss all of your options, and we can kind of figure out, which avenue.
Avenue.
Which avenue is best for you.
Yeah, see what's the best route. The route, avenue, candidate, whatever it may be, that's going to be the best ways to have a consultation with Dr. Emer, virtual, in person, whatever it may be, so we can really let you know exactly what you're going to need, how many, whatever it may be, if it's going to be surgical, non-surgical, filler, Bellafill, hyaluronic acid, whatever it may be, and how many you're going to need.
So I saw some questions. So our main practice is located in Los Angeles, specifically West Hollywood, Beverly Hills area. We do go to New York every 3 months or so.
Yes.
So if you're on the East Coast, you can easily travel to New York. So what we do with our New York patients is we typically do a virtual consultation first. So whenever Dr. Emer physically goes to New York, you can go in and get your treatment done.
Yeah.
So if you are a New York patient, if you're located on the East Coast, our next dates are in November. What is it? November 12th
through the 16th.
There
so
we
there
go.
Friday, Saturday. So we have a Saturday clinic for all of those patients that work, which is most of us right now. So we'll take you on Saturday. And then Monday and then Tuesday is a half day. So we're happy to see you and do a virtual consultation with me and Dr. Emer. We can go over exactly what you're going to need. Come in for your treatment. Smooth and easy.
Hug from Brazil. We'll give you a hug back here. We'll hug each other for you. Hug from us. Okay, is that Pamela Anderson? Oh, you're just getting all the compliments today.
I mean, I'm going to take it.
Absolutely.
Yeah, this is Jenna Dean.
The Dean.
The Jenna Dean.
All right. Are the fillers okay to get if you have a sensitive, oh, I mean, good for you that you're sensitive and hopefully that enhances your sex life. But yes, the fillers are not going to affect your sensitivity at all. You're not going to notice a difference, but your partner definitely will. Let's see. Oh no, there's some questions that we've missed. Let's see. You know how to make cheese in the middle. Okay. Let's see. Oh my god. Okay. Fixed it.
We've been going for 50 minutes now.
I know, it doesn't feel like it.
Hot topic.
So, like I said before, if you're circumcised or uncircumcised, we got a treatment for you. That is not going to affect if you're a candidate or not. I know a lot of men are worried about that. And some men, like, we do offer circumcision. So if you are uncircumcised and you're looking for a solution to that, we do have a urologist on staff that can help you with that. So wait, how long do they have to wait between circumcision and filler?
30 to 45 days is highly recommended between treatment.
Is it okay for male parts? Oh my god, absolutely. Been talking about this all night.
We take care of a lot of them.
Yes, we do. We enhance one penis at a time, and we do a lot of penises, guys.
Yes. All right, I think
we're getting faces with iHeart. How much for circumcision? How much is it for a circumcision right now?
That is something that we can set up for you. So you'll have a consultation with Dr. Emer, and then we would refer you to our urologist on staff. And then you'll have a personal consultation with the urologist and discuss that situation with them.
Absolutely. And like I said, guys, everyone's case is a little bit different. There isn't a one-fits-all type of situation, but that's why when you come in for a consultation, we can really customize everything that kind of fits your budget, fits your lifestyle. Do you also do facial fillers? Oh my god, absolutely.
Fillers by Dr. Emer.
If you couldn't tell, we both have facial filler. Try to guess where we have it. So I think one thing about facial fillers that everyone always asks is, can you tell someone's had it? If it's good work, and if it's done by a great provider and injector, which Dr. Emer is, you won't be able to tell someone's had filler.
Yeah.
And that is the whole point.
Honestly, it's my favorite treatment. It's instant gratification, is like I like to say. And we'll lead you in that direction. We have a lot of patients that come in that have never ever had any type of facial filler before. We want you to feel comfortable at the end of the day. We'll lead you in the direction. We'll tell you exactly where it's going to be injected. We'll give you an idea of how long it's going to last with each filler. You get a customized treatment plan when you come into our office.
Is a rabbi included in the circumcision? You know what? If you need a rabbi, I'm sure we can arrange that for you. We are in Los Angeles, by the way. There are a lot of rabbis around us. God, what was that other question? I read it and then I forgot it because I feel like I'm like halfway through this book. Oh, it's what vintage we're on.
Yeah.
Are we? I mean, this was a 2019 red blend.
I'm not 2018 as well.
So every time we mention the word filler, apparently we need to take a sip of wine. Is that a thing?
55 and want to look younger. How can I make an appointment? Make an appointment. DM us. You can do appointments at JasonEmerMD.com. There's so many avenues. Go to our website, please. We are here to help you. You can make appointments.
But definitely, I think the easiest way right now, just DM Dr. Emer's account. We look at it 24/7.
Yeah.
Send us your name, your email, your phone number. We'll give you a call. We do like to make things as personal as possible. So we do like to call all of our patients just to make sure that your needs are met and your questions are answered.
What is the average wait time to get in? Honestly, we're always working. We make time for every single patient. We are almost completely booked, but we will find the time to fit our patients in. We all work around the clock to service you guys.
Typically, if you call and you want to make an appointment, we can typically get you in within a week or two. So it's a very fast process. We don't have a waiting list. We don't believe in waiting lists. We believe that if you want something done, we'll deliver. So that's one thing that we do pride ourselves on. Do you do male to female surgery? So actually, we do work with a doctor who had a trans residency. So he's used to doing top surgery. I have seen photos of a vagina to a penis, which is honestly out of this world. So yes, we do work with the trans community. We work with the non-binary community. So no matter what community you're a part of, we do accommodate you, and we can definitely steer you in the right direction.
Absolutely.
So let's see.
Yeah, Brazilians. Brazil.
I know. Hey, Brazil. And I know there was another question. I already forgot what it was. Man, is there anything else we should talk about tonight that you guys want to know? We've talked about facial filler. Saudi Arabia.
We have a lot of patients from Saudi Arabia.
We love you guys. Can you put a sample male to female photo on your Instagram? So actually we get this question a lot about why we don't post certain things on our Instagram. And honestly, it's all up to the patient. So we do need to find patients that are willing, you know, to send in their before and afters and allow us to use your before and afters.
Yeah.
So, you know, it really depends. A lot of our trans patients are very private, so that's why we really don't post a lot of them. And, you know, we really do respect their privacy. But again, if you have those questions, if you really, you know, need those answers, you know, book a consult. All is normal in WeHo. Absolutely.
We love WeHo.
Guys, we're in Los Angeles. We don't judge anything that you do. You know, we can definitely help you with. I think we have a fantastic office. Our staff is great. Our staff is nice. We're not judgy. I think a lot of people come in this industry and just think, God, everyone who works in aesthetics, they're going to be uppity and like, oh my God, no, we're not like that, guys. Not at all.
We're your family. We're your friends.
Absolutely. We want you to get the results, and ultimately we want you to be happy.
Absolutely.
You know, in the skin that you have, in the dick that you have, we want you to be happy. That is our end goal.
Absolutely. All right.
And let's see. Patients are the absolutely. Oh, Jordan, you're so right. Our patients do become like family.
Absolutely.
So the patients that I've had for a couple of years, when I enter the room, we don't even talk about treatments. We talk about how they're doing.
Yeah.
And that's honestly part of the job that I really enjoy, is getting to know our patients, getting to know you, and improving your life. Have it be through penis filler, have it be through lasers, have it be through chemical peels and facial filler.
Yeah. All right. Well, I think this was a success. I can't even talk.
I think it was a success. How many of you want us to do just like Wine Thursdays or Wine Fridays or Wine Wednesday? You know what?
Yeah.
Wine Wednesdays I think would be better.
Yeah,
That actually kind of...
We've hit a lot here tonight.
Let's see. And that is exactly the energy that I'm picking up from both of you. Thank you.
Thank you.
This is how we are.
Please, everyone come visit us in Los Angeles, in New York, virtually, whatever it may be. We'd love to talk to you. We'd love to help you in any way. Like I said, we treat from the head all the way down to the toes. You'd be surprised.
And everything between.
Yeah, you'd be surprised the outcomes that we have in our office. And we love all of you, and we can't wait to see you, talk to you in any way. And we're here for you.
Absolutely.
All right. Well,
so guys, I have a whole bottle to finish. I'm not going to do that on camera because I get quite sloppy towards the end of the bottle.
yeah, we're going to eat some pizza.
Oh my God, we have pizza coming?
I have pizza.
Oh my God, yes.
So we're going to eat some pizza. And then, yeah, we have to work in the morning too, so.
Oh, we do. So if we don't get to you right in the
late.
morning, you know why. You know why. But again, guys, if you have those questions, if we didn't answer your question, I apologize. But call in. We'll figure it out. We'll answer those questions.
Yeah.
And hopefully we'll see you in the office sometime soon.
DM us, email us, Instagram us, Facebook us, whatever avenue you have. We would love to hear from you. All right.
All right.
Good night
It's
from
been
Los
awesome.
Angeles.
This is not going to be the last time.
No.
So we will see you soon.
Yeah.
And I'm glad you're drinking
And
too.
yes. Cheers.
Cheers, guys.